The county that's been hit hardest by the state's HIV outbreak will continue operating a needle exchange program for at least the next year. Indiana's State Health Commissioner approved Scott County's request to continue operating the program, which started after Governor Mike Pence signed an executive order in March. That order expires Sunday. And as Barbara Harrington reports, while the needle exchange won't go away, some are worried the funding will.
And at this time, we are going to hear the public hearing on the needle exchange program for Scott County residents.
It only took a matter of minutes for Scott County commissioners to unanimously approve continuing a needle exchange program aimed at curbing the alarming spread of HIV in the area.
I might entertain a motion.
During a public hearing earlier this week, no one spoke out for or against the program. It seemed all of the people in this room had come to a consensus. This was just something that had to be done.
We've been working really hard on this needle exchange program, and there was that small chance that we might not be able to continue that. And people would ask us, what are you going to do if it doesn't get passed? And we honestly did not know.
Since December, at least 160 people have been diagnosed with HIV, the majority of them from right here in Scott County. The state stepped in to help in March, setting up a one-stop shop where people can get tested, sign up for insurance, and enroll in the needle exchange. In the short time the program has been operating, health officials have handed out more than 16,000 needles, and they say it is making a difference.
I mean, our whole goal from the beginning was to stop the spread of HIV, and I know that we are doing that because I know personally of 5 people that we have in the needle exchange program that were tested for HIV in the beginning, and they were negative, and they were just retested, and they're all still negative. So I know we've helped at least 5 people.
Scott County is the first county in the state to operate a needle exchange program under recently passed legislation. The law allows counties at risk of an HIV outbreak to ask for permission to set up an exchange, with the state's health commissioner having final approval.
This morning, the state health commissioner approved a local needle exchange program in Scott County as allowed through Senate Enrolled Act 461.
But the legislation has no state funding tied to it, and that has some people worried.
Right now we're very lucky because we have had a lot of donations that have come in, money donations and also donations of needles. And so right now we are desperately trying to seek as many donations as we can to keep it running as long as we can.
Now Scott County has to figure out how to fund its long-term response to the HIV outbreak. Will they be left to come up with the money on their own, or will the state pitch in to help?
There are no state funds that are appropriated for needle exchange programs within individual counties, but counties can work with their partners to determine where those resources and funds may derive.
Scott County still plans to ask the state for help with funding the year-long needle exchange. Commissioners also want help paying for additional staffing at the county health department, which has been working overtime to combat HIV. They're requesting an incident coordinator who can deal specifically with the outbreak and an additional registered nurse.
That way it frees up our administrator to do the day-to-day operations that we had before. We still have them, goes on daily.
Without the state's help, it could be difficult for the county to come up with the money to continue its prevention efforts. But county commissioners say if they have to, they'll take the proposal to the county council, and they're confident they'll find a way to crunch the numbers.
Any county that tells you that they're not worried about funding, I'd say they're probably not being honest. So yes, I definitely, we worry about funding, but really, do we have a choice?
After 1 year, Scott County will reevaluate the needle exchange program to determine whether it needs to be continued. The State Department of Health says it hasn't received requests from any other counties wanting to start similar programs, but the possibility is there. Diane Janowitz is an infectious disease physician with IU Health. She's been working with a team of doctors in southeastern Indiana to combat the HIV epidemic, and she recently wrote a Time article on what steps like a needle exchange can be taken to prevent another outbreak. Thanks so much for joining us. You know, we've been talking about this, seems like every week for the last month or so, but every time you see those numbers just kind of keep going up. I think we're up to, what, 166 right now. Do you know by chance, is it by chance that people are just coming forward, or are these prevention methods not working as well?
Well, I think the prevention methods are working. In fact, even though the numbers are continuing to climb, what we've seen is that each week the numbers that are positive, the number of people who are HIV infected are decreasing. So we're reaching that slope of the line where we're tapering off in the number of new cases. So we have made a difference. You
pointed out that nationwide only about 8% of HIV cases are transmitted intravenous drug use. The rest are sexually transmitted. So does that mean that we need to rethink the way that we're educating people about HIV prevention at all?
I think so. So, you know, many people are aware of the risk factors for transmitting or acquiring HIV, but in some certain areas we need to put emphasis on not only just the sexual transmission of HIV, but the transmission through IV drug use as well.
Do you expect other counties to start using the needle exchange program at all?
Well, so that's going to be up to each of the counties, and I think what's going to be important for them is to recognize the need for that. So they have to see that perhaps they have people who inject drugs and that those numbers are high, or perhaps they have a higher hepatitis C or a higher HIV prevalence than we see statewide. So those are clues to each county who would then decide whether or not this would be beneficial for them.
But there's still a political element for that to happen, right? The state health commissioner has to declare a public health emergency, and then from that point on, there's some final approval. Do you think there would be a lot of red tape that the counties would have to go through that might not be done in time to help at all?
Well, so I think each of the counties is going to have to recognize the need that they have. And there are many state health officials and local health officials, as well as healthcare providers, who can help each local community recognize the warning signs that perhaps this too, what happened in Scott County, can happen to them, and then perhaps prevent that outbreak with implementing this, as well as many other mechanisms that exist.
You and many others have been in Scott County. What happens when all of you leave? How do they transition?
Well, so there's absolutely going to be a transition plan, and ultimately what we need to do is make sure that the infrastructure is there so that this community can sustain itself. And that infrastructure incorporates many different aspects of care, so not just medical care, but behavioral health and mental rehabilitation services as well.
One more quick question, just regarding non-healthcare factors. Are there other things that counties can do, like Scott County, for HIV prevention?
Well, I think it's got to be a multifactorial approach. So you have to have a lot of infrastructure from the standpoint of behavioral and mental health rehab. We have care coordinators who are helping all of our patients in Scott County access all of those other services. And so they're instrumental in a holistic approach to anybody who has HIV or any other chronic health problems.
All right, thank you very much for being here today. Appreciate it.
Thank you.